Hachchechoktia Adal Miss Ann Quileute. Good afternoon. My name is Miss Ann. My English name is Ann Penn-Charles. I'm from the Quileute tribe. I work with our Quileute Human Services department. And one of the things that our community faces dealing with addictions, opioid use, sometimes if a person seeks or asks for help, there's those of us that are here to help them. But sometimes it's really difficult to get a bed for detox or even get a bed open, because there's so many things that our clients have to do, which I get it. Don't get me wrong, with COVID here, getting the TB tests, getting the physical, the ride would be no problem. We can get our clients anywhere. It's just the lack of beds, the lack of services for, just a detox. So we have some wonderful co-workers of ours that I can reach out to any time of the day, when we have somebody that maybe comes to our office or comes to our houses that are on our doorstep. But there's limited services way out here on the coast. We're way in the rural areas, Seattle, Tacoma, places like that. Maybe they have these beds, but our tribe and our programs, we do not have access to some of the program or the services that our clients need. Everybody's fighting for those beds, and some of those tribes that have money at their fingertips, sometimes they can secure beds. They pay for those beds, just in case one of their members come. We are not fortunate to have access to funding that helps our clients like that.
Yeah, and that also extends to internet and mental health services too. Sure.
Absolutely.
Yeah.
Yes.
So my name's Jody Heller, and I'm the substance use provider out here. I actually hold a credential as a trainee at this time. I'm just completed all of my hours, so I'll be testing here very, very soon. And I work here at the Quileute tribe, which I love. I also have family members on the Skokomish and the Squaxin reservations. And the challenges that I've seen in Quileute, like Miss Ann stated, the fact that we are so rural, and we're a very small community. This tribe is not very big at all in comparison to a lot of tribes. And so the challenges that we've seen since I've been here, with COVID especially, not having our clients having to do Zoom meetings, some of them don't have phones, some of them don't have phone cards, and the phone cards that we did have, they, a lot of them only go, say, to the 12th of the month or the 18th of the month. And a lot of these people are on probation as well. So it's mandatory that they attend, our sessions, and in person and in group sessions. And so Miss Ann has been such a huge help with the phone cards, with fuel cards, with even with Walmart cards, clients that have to go out of town to, receive care, getting, like she said, getting family members and or, Human Services have said, here's our van. We here at the clinic don't have a tribal vehicle that we can get clients to treatment in. And, she has been exceptional. She and her agency both, in supporting us at Quileute Counseling and Recovery Services in serving our clients. Huge, huge, huge help.
Wonderful. What are some of the things that work? What are some of the things that you found that actually work to help people in your communities?
Okay, so one of the things that help connect our community members, I was very fortunate to run across a healthcare authority funding for cell phones. I was able to secure a laptop for our counselor. these HCA phones that were connected to Verizon. So, you know, getting these these cell phones into the hands of our clients, I was able to service our clients that are utilizing the behavioral health program, our senior center program, our victims of crime, our Indian child welfare, you know, youth that needed to have phones to access to their counselors, you know, child psychologists, you name it. So we did have a program where I was able to purchase the cell phone minutes, and we did $40 a month. Those services are no longer available. That grant funding ran out. So trying to find a place where people, if they run out of minutes, to go access the internet so they could do those Zoom calls or join the Zoom meetings, or maybe it's, you know, to set up their services for their counselor, their mental health counselor, child psychologist, even attending the court dates, you know. It really helped our program. But now these phones, you know, are the phone cards, I'm no longer allowed to assist with phone cards. So we're trying to secure other funding, the tribal telephone assistance program. So having our clients access that, but yet again, they need internet to access that. These companies are not open. We don't have a telephone company out here, so everything is online. So there's so much documentation too that you need to apply for these programs. For us to have those phone cards, whether it be Verizon or Straight Talk, you know, it was helping our clients. We encouraged people to get Straight Talk, but how many people have $100 offhand just to go sign up? Then they have to go into Port Angeles, which is like 60 to 80 miles away, one way. So they have to go in and go sign up for those Straight Talk phones. So the barriers, you know, it was really good when we got those phones and I could access the phone cards. And then once that pandemic money ran out and I'm no longer able to get the $40 phone cards even, or that Straight Talk phones for them, it really impacted our services to our clients. So I was servicing elders and I was servicing youth as well as our behavioral health programs.
And I just would like to chime in on that, that our client participation levels have dropped since we have not had access to be able to support them with minutes on their phones. And again, I just would like to reiterate, a lot of them are court ordered. And so, you know, you're really your back is against the wall when your resources are so limited and the requirements are great. And so so I'm here at the clinic. Normally my work week is Monday through Thursday. I work late Tuesday night holding our group. And I'm usually off on Fridays, but anyhow, being able to have our clients engaged and not have fears about, you know, not being in compliance because they don't have the funds, they don't have the resources to be able to attend. It's just this catch-22. And so another thing that I'd like to say that worked, Miss Ann and so the human resources, when I say that, I mean Miss Ann. Basically, she came up for several days actually and spent a couple days up here with us. There was rain, there was wind, there was a bunch of madness and craziness going on. And the New Beginnings program, and we set up in the parking lot because we were limited to, you know, social distancing and whatnot. And we had the Narcan training, and we had incentive bags and these swag bags, and everyone played a part in that. And people got to walk away with, you know, essential oils and these cute little kits for growing seeds to grow some herbs with, and these amazing sweatshirts, and just a lot of stuff. And they walked away with a Narcan kit, and they walked away with the knowledge of how to use that kit. Our goal was to get a kit in every single household on the reservation and surrounding community. And Miss Ann, do you have numbers on that? I should have looked it up.
We serviced 24 at our Quileute Tribal School. We serviced, I want to say it was 96 community members. And we had, out of those 96, we had 8 youth that were under the age of 18 because they have family or friends that do drugs within their family structures. And they were able to learn how to do the nasal kits. And so they know where they can get them or who has them so that they can call to get help if they need it.
It was an amazing presentation. And my hands truly go up to everyone that was involved in that. We will have another one here soon, maybe a little lower scale, smaller scale, but we have kids in the office here. Miss Ann has kids in her office, people in the community, clients, and just community members. They know that they can contact either one of us if they need a kit. If you're using it, please use it. You know, that's what they're there for. We will replace it. Please use the kits.
That is absolutely amazing. Honestly, if I had been trained to do that when I was younger, I could have saved a family member and some friends. Like, that's really a truly amazing service you all are offering. Thank you. It's
Absolutely
wonderful. That's my last somewhat heavy question is, why do you feel it is critical for state agencies and probably some grant funders to be Native led?
So I feel myself that some of our agencies, they need a Native led person, leader. One of the things all of us pretty much across the whole United States, from Alaska to Hawaii, we were all taught to take care of our family, youngest to the oldest in our whole family structure. So I have a mother and father. So I have both sides of my grandparents, plus all of their children, all of my first cousins, second cousins, third cousins, fourth cousins, fifth cousins. We're family. So when we really look at our family structures, we take care of our own to the best of our abilities. It's not that we are imposing on grant-funded agencies, state agencies, you know, even those small 501(c)(3) organizations that do so much, but being so far out here in the rural population, we're not on the I-5 corridor. We are so remote. It takes 4 hours just to get from Seattle to here on a good day. So not having internet access, we do have a store here. It closes at 8 p.m. We have 2 places where we can get gasoline, and it's very expensive. We have a Lonesome Creek store that's here. We have our own restaurant. We have our we have Oceanside Resort, but our unemployment here is 80% unemployed rate still, even today. People don't have access to a reliable car to get back and forth to work. We have limited transportation. So knowing all the barriers are all the unmet needs of our communities, a person that is in those state programs and the Indian policy, you know, IPAC, do they even go out and view all the tribal communities that they're supposed to be speaking for? You know, Are they going out to find all of our communities that are way on the coast and over the mountains and along I-5 corridor? Don't get me wrong, we all still have the same unmet needs. We don't have DoorDash, we don't have McDonald's, you know, we don't have pizza deliveries. So when people come out here to visit, we have one cell phone tower, and that's Verizon. You know, we pay such exorbitant rates for our Verizon phones. And if you're on a limited family plan, or if you're on the pay by the minutes, which a lot of our people are, $15, you know, just to keep the phone on, but you can only get text messages. If they got $40, it only lasts until, Jody, that was funny. It only lasts till the 10th, because they also have to do not only their Zoom meetings with their providers, they have to get on the Zoom meetings for court.
Yep.
So, you know, and then the probation officer, you get to meet the probation officer, but our people, we really need somebody that understands how our tribal entities all work. Not very many landlines out there, very few landlines within our tribe here. I think we probably got, there's 150 households down here, and there's probably 20 landlines down here within our community, because CenturyLink is not the best, you know. And then if you've got internet on that, it's the slow modem. So you're trying to join Zoom and your screen freezes. There's so much lack of services within our organizations. We have key people in key positions. We're building things back up, but we still need help. And for those that are there that have never, you know, got into any of our tribal celebrations or any of those sorts of things with the good times, and when you see community members in there, they're so proud to get in and help, but yet they got so many things that are on their shoulders. They got court obligations. They got to, you know, they're still fighting to get full custody of their children back. You know, they're barely holding their head above water by paying the rent and putting food on the table.
Oh, no.
Perfect example of the internet.
And, you know, well, while we're waiting on that, I just wanted to pipe in too, you know, going back to the cell phone minutes issues, which truly is, in my opinion, one of the biggest issues here with our clients, having their visits with their kids too. I mean, you add all of those things, and how can you pick and choose between your visit with your child and your visit with your counselor that's going to, you know, you have to stay in compliance. But if that, you know, 1 hour session is going to cost you even 15 minutes of your visit, your Zoom visit with your child, you know, it's tragic. It truly is that there are so few resources available to the community members here. I'm also going to pipe in with Native run programs. I just want to give you my answer really quick while we're waiting.
Please.
So when I look at Native run programs, I look at the holistic values that Natives embody. And, you know, like I said, I had family that are Native, and I've actually worked only in the last 15 years. I have 13 of those years I've worked for tribes in Washington State. And I hope to always only work for tribes, because I absolutely appreciate the value that they place on their clients' lives, on their needs. I see needs being met. At least I've had the honor and the privilege of seeing needs met in Indian country on a way more personal level than, you know, in a state-run agency or a county-run agency, for profit or for nonprofit, either, you know, either of those. And so the fact that I am able to be here, and I was actually out sick for 3 of the 4 weeks in January, with COVID, and then a personal medical issue that took me out for about a week, well, for a full week. And I own a home in Elma, Washington, and I come up here every morning and I stay until Thursday night. And the bottom line is that 3 weeks that I was away from the push, I missed the land that I'm able to work in 4 days a week. I mean, I truly missed the land here. I missed my people, you know, and not being a tribal member does not mean that they are not my people, because they absolutely are. And they've welcomed me in. They've shown me they've been truly gracious to me, coming in as an outsider and being able to create, you know, a healing environment with each of them has been nothing shy of phenomenal.
Yeah, it is. I would agree. The land out there is stunning. I think it's probably one of the most beautiful places on the coast.
Agreed. Yeah, agreed. It's amazing. My heart is here. It's crazy, you know, to say that, but it truly is. My heart is here, whether I'm here or not.
Yeah. Well, I'm not sure we're going to get Miss Ann back. Do you want to ask the last ones?
Yeah,
And then,
Jody, I'm just really curious, how can people take the initiative to volunteer and give back some of their free time? I know it's obviously, if someone is, you know, viewing this from Seattle or surrounding areas, like Miss Ann said, it's not a hop, skip, and a jump, but I'm hoping that there'll be people that'll be watching this that have the means to be able to give back and help others, right?
Right. So if there was a way to donate phone time to the Quileute tribal members that are in, you know, any of the tribal members, that would be absolutely amazing. Fuel, we had fuel cards and Walmart cards that we were using as incentives for our clients here at the clinic. Those have completely run out, and it is tragic to have to tell. Just last week, I had a father that's also a client here at, you know, behavioral health, that called and said, "Hey, I've got my visit with my kids today. Is there any way you can get me some fuel to get into town to see my kids?" And I had to tell him no. There's nothing worse for a provider than to have, you know, a client that is in dire need of services and to tell them that we don't have them, that they're not available. And not that they got used to having those services necessarily. And we all knew that they were going to end. You know, we had so many, but they are so truly vital. Like Ms. Ann said, our unemployment rate is 80% here in the push. And, you know, when you have clients and community members that are doing every single thing they can to do the next right thing, and the barriers are so great. Yeah, there's, like I said, phone cards, fuel cards, those would be ultimately probably the two things that Quileute tribal members could use the most, in my opinion.
wonderful. Thank you. Thank you very much.
And lastly, Jody, before we let you and your team get back to work, where can people find out more information? Is there an easy link that we can share on our international radio station here, and that's something that we can post up as well, please?
So, you know, I wish, can I get back to you on that?
Sure.
Sure.
Okay.
It would be the tribal office.